Welcome to The Explainer. So today, we're going to investigate a condition that affects millions of people, but often stays a total mystery. We're going to play detective and crack the case of the body's slowdown.
Okay, let's just dive right in. Have you ever felt like your body's engine is just sputtering? Like you're running on fumes? Well, you're definitely not alone. We're going to treat this common but often misunderstood condition like a detective story, piecing together all the clues to figure out what's really going on.
All right, so every good mystery needs a main character, right? And in our story, that's the thyroid gland. It might be small, but as you're about to see, it's pretty much the master regulator of your entire body.
So just think of your thyroid as the master thermostat for your whole body. It's the control center for pretty much everything. It regulates the metabolism of nearly every single cell, telling you how quickly to burn energy, how warm to be, and how fast your heart should beat. It is absolutely fundamental to how you feel and function, literally every second of every day.
But here's the thing, the thyroid doesn't work in a vacuum. It's part of this really elegant command chain. You can kind of think of it like a company, right? You've got the hypothalamus, that's the big boss, the CEO. It sends out an order. The pituitary gland, our manager, gets that order and tells the thyroid, the factory, to get to work making hormones. These hormones then go out and run the body, and they also send a status report back to the CEO and manager saying, hey, job's done. This incredible feedback loop keeps everything in perfect balance.
Okay, so what happens when this perfectly tuned system starts to go haywire? Well, that is the central mystery we're digging into today, a total system slowdown.
All right, our first clues, they're the symptoms. And you'll see they all point to one thing. The body is just slowing down. Your metabolism drops, so your energy plummets. That's fatigue. You burn fewer calories, maybe you gain some weight. The whole system just gets sluggish. But here's the catch, and it's a big one. These clues are so common, they could point to dozens of different things, which makes them really unreliable for solving our case. And, this isn't just a guess. The actual medical literature totally backs this up. Basically, what this quote is saying is, if you try to diagnose this thing based only on how someone feels, you're probably going to get it wrong, a lot. Our investigation needs harder evidence.
And that harder evidence leads us to, well, kind of two different crime scenes, if you will. First, you've got overt hypothyroidism. This is where the factory is just clearly broken. The manager is yelling for hormones, but production has tanked. Then there's subclinical. Here, the factory is still getting the job done, but only because the manager is screaming at the top of their lungs 24/7. It's a major warning sign that the whole system is under serious strain.
Okay, let's get into the investigation proper. Now that we know what's happening, we got to figure out why. What's actually causing this slowdown?
So, in places where people get enough iodine, there are a few potential culprits. But our investigation points to one prime suspect that's responsible for the vast majority of cases. But here's the crazy part, the twist in our story. The call is coming from inside the house. Yeah, the culprit is the body's very own defense system.
This, my friends, is Hashimoto's thyroiditis. It is our #1 suspect. It's a textbook case of friendly fire, where the immune system just gets totally confused and launches this full-scale attack on the thyroid gland, slowly but surely destroying its ability to do its job.
So, how does this whole friendly fire thing actually go down? Well, it's not like a single shot. It's more like a slow, complex siege. It starts as some kind of trigger, a mix of genetics and something in the environment. And then immune cells invade the thyroid. They unleash all these inflammatory molecules and actually cause the thyroid cells to self-destruct. It's a gradual but devastating process.
So you might be wondering, who is this prime suspect most likely to go after? While this can affect anyone, the evidence is pretty stark. This condition is a staggering 7 times more common in women than in men. Now, the exact reasons why are still being researched, but it's likely linked to differences in how the immune system works and the influence of sex hormones.
Okay, so we have our prime suspect. We have a clear pattern. So how did doctors actually crack the case for any single person?
The big aha moment here, the real breakthrough, doesn't come from some crazy complicated procedure. It comes from a super simple blood test. A doctor will first check the TSH level. That's basically measuring how loud the manager in the pituitary is shouting. If that level is high, they'll double check by looking at the factory's output, the free T4 hormone, to see what's really going on.
And here is why this is such a brilliant diagnostic tool. There's what's known as a log linear relationship between these two hormones. What that really means is that even a tiny drop in the factory's output, the thyroid hormone, causes a huge spike in TSH.
It's like an incredibly sensitive smoke alarm for a fire in the thyroid, and it catches problems really, really early. So once the case is cracked, the diagnosis is in, the story pivots, right? It goes from investigation to management. And for most people, this is an ongoing, lifelong thing. And if you want to get a sense of just how big this story is, just look at the numbers. Levothyroxine, which is the main treatment, is the third most prescribed drug in the entire United States. I mean, this isn't some rare, obscure condition. This is a part of daily life for literally millions and millions of people.
The strategy here is actually, in theory, beautifully simple. Since the body's own factory can't make enough of that T4 hormone, you just give it back. You replace it with a synthetic version. The goal is to give the body exactly what it's missing, which lets that pituitary manager quiet down and brings the TSH levels back to normal.
But our story has one last twist. Because even when the blood tests look perfect, a big chunk of patients, up to 15%, still feel off. The mystery, it seems, isn't totally solved. And this, right here, points to the lingering puzzle in our case. It's about more than just taking a pill. See, for that 15%, the problem might be something else entirely, like how their body converts the medication into its more active form. There are constant debates about different therapies, big challenges with how food and other meds affect absorption, and the really tricky process of dialing in the perfect dose. The bottom line is, for some people, feeling truly normal again can be a really frustrating and elusive goal.
And that's where we'll leave our investigation for today. We've figured out the main culprit, we've looked at the go-to solution, but that final chapter, it's still being written. Figuring out why the standard treatment doesn't bring everyone back to 100%, well, that's the question researchers are still working hard to answer. It's the last, stubborn piece of the thyroid puzzle.